is in the studio, and if you follow us on Facebook, you know who that person is, and that's Dr. Cindy Besson from Women's Health Associates right here in Aiken, South Carolina.
Yeah.
Yes, and we're wrapping up Breast Cancer Awareness Month. You guys, we have had awesome information here, and we have been had a lot of awesome guests. I was telling Dr. Besson, the guests that we have had that's been given some great information, new information that I didn't even know. So we always learning. So we just want you to tune in this morning with us this morning and just listen in because she has a wealth of knowledge. And women, we just got to be aware. We got to know our bodies. We got to know our lemons. Like they said, know your lemons. And so we're ready for this wealth of information. But I'm gonna hand it over to Coach Patrick.
Yeah, so we missed our jingle this morning. I should have sung it.
It's too me. Now I'll do that.
Okay. Listen, CSRA, good morning. It's cold this morning, but it's good. It's still a day the Lord has made, and we're going to rejoice and be glad. 1 in 8 women in the U.S. will develop invasive breast cancer. Early detection, we know, is the best protection. Now, ladies, if you feel something, or men, if you feel something abnormal is occurring in your breast, you should consult your doctor immediately. Now, we have an awesome guest in here with us this morning that's going to help us talk about this on this morning, Dr. Cindy Besson of Women's Health Associates. Thank you so much for being with us. Just let the people know who you are and hear your voice and jump right into it. We're going to talk about breast cancer. We can start with talking about what breast cancer is.
So, Bruce, thank you so much for having me here today, and I sure appreciate all y'all do in the community to help encourage people and have a way. People often want to do something to improve their health, but they don't often know what to do. So that's where it's so great to have y'all here to help people find that way. Breast cancer is one of the most difficult things that personally I deal with in my practice of gynecology. It's when tissue in the breast becomes abnormally stimulated to grow. And so it grows and takes over the areas of the normal breast and causes tumors to grow or a tumor to grow. And then that can either grow locally in the breast or it can spread then to other parts of the body.
Wow. So that now I mentioned earlier when I talked about I came on the show and I said, well, women, but I also mentioned men,
Yes.
Because men have breast cancer too. So it's important that we be watchful of those things also.
Yes.
That's exactly true. Anyone who has breast, men and women have breast. Women just have more breast tissue than men, but men can certainly get breast cancer and have to be monitored and know that that's a possibility as well.
Mm-hmm. And there are a lot of myths out there about breast cancer. So we're just going to cover some of these myths about breast cancer and the risk of breast cancer. So one of them is there a link between diet and breast cancer risk?
There really is. We know in the United States we eat a very unhealthy diet as a whole. Higher fat content that you eat, the more sugar you're exposed to, the more the heavier you are over your ideal body weight, you have abnormal levels of estrogen floating in your body, and so that puts you at risk for all kinds of problems, diabetes and breast cancer, uterine cancer. So yes, the things we eat do affect our risk and increase our risk of breast cancer.
Wow. Does antiperspirants increase the risk of breast cancer?
There's some studies that question about whether or not some of the contents, aluminum and such, that are in antiperspirants could increase the risk because things that go under your arms can be absorbed into your breast tissue. There's probably a lot more we're exposed to that we have not looked at studies and don't know. If you look at lots and lots of things that women are exposed to, particularly men also, cleaning products, all kind of things that we handle that absorb into our body that increase our risk. So one of our things at Women Health Associates is to try to look holistically at your life and at your body and realize what you're exposing yourself to, that you put on your body and that you put into your mouth, and that you breathe into your body? What are you putting in your home? What are you cleaning your home with? What are
Wow.
you, all kind of things that have so many chemicals, especially in the United States, that we use a lot of chemicals in a lot of things. Our foods, our products that we use. There are a lot of things we're exposed to that we really don't know the answer, but yes, deodorants are things that you need to look at and try to find something that is pure and has less chemicals in it.
Wow. You know, and we were just looking at the news the other day, and they were talking about athletic clothing and how the
Spandex.
the spandex and polyester material uses a BPH chemical that from recycled plastic, and that's causing some things.
To stretch out the material. So I don't know if they still doing research in that, but
They're still researching.
I was just talking to myself. I said, why is it that women getting breast cancer at so big of a numbers and at a younger age? So it's a lot of things out there, like Dr. Besson just said, what we wear, what we putting on our body, what we inhaling, and from lotion to makeup. We just don't know the things that women is more exposed to because we're more fashionable with people. So we tend to dress up and make up and do all those different things. So you're absolutely right, Dr. Besson. We have to be aware.
Yeah. And now we still dealing with these myths. A bra, does wearing a bra increase the risk of breast cancer?
There's not a study I'm aware of that shows increase in, actually, in the more developed countries, we have more likely to wear a bra than in some of the undeveloped countries, and we have a higher incidence of breast cancer. But in my opinion, it's probably the things we eat, the things we're exposed to, more so than a bra. A bra is really just for support and for comfort.
A couple more, because these came up, so I just want to clear these in here. We're gonna dive. I'll let you. I know you and Jackie gonna dive into this real good in a minute. Abortion. Does abortion impact breast cancer risk?
I've not seen a number where abortion increases. We know that having live births and nursing your child and having a child at a younger age decreases your risk of breast cancer. It would be hard to tease out that number of abortion to know, if somebody only had abortions and never had live births, and I mean, that would put them at risk, but it wouldn't be the abortion that put them at risk.
Okay, good. And finally, the myth, breast implants, does it increase the risk of breast cancer?
We've not seen where it increases the risk of breast cancer. It may make it more difficult to detect, sometimes to see around that implant. But I've not seen a number that shows that it increases the risk. You still need to be monitored. Some people think if you have an implant, then you shouldn't have a mammogram and that sort of thing because of the risk of rupture, and that's not the truth. You need to continue to have mammograms even if you have implants.
That's awesome. And so, Dr. Besson, I know a lot you want to say, so you can go ahead and just kind of share what's on your heart and what you want to talk about, because things does change and women are surviving more breast cancer. So there are more advanced studies, there are more things that can procedures and things in place now to help women survive. So go ahead and just talk about what you want the people to hear out there.
So breast cancer, even though it's very common, 1 out of 8, it used to be that, lots of women died with breast cancer. There's so much in the last 5 to 10 years that has been discovered about how to treat breast cancer that we have much higher survival rates. Talking about genetics, one of the things that we do now is we know the genetics of the actual tumor. Not all breast cancer is the same. Breast cancer is very different. We have a huge array of types of breast cancer. And depending on the type of breast cancer is, first depends on how fast it grows. We used to think breast cancer just grew at a very slow rate. Well, that's not the case. There are some cancers that grow rapidly. And so we know it all depends on the type of tumor the cancer is. But also because we know now about those types of tumors and what their genetics is and what their makeup is, we can also know more about how to treat and cure it. So our cure rate is a lot higher than it used to be.
Good.
So we aggressively treat breast cancer, and we have a much higher success rate in the treating of breast cancers and tumors. So that is an exciting change that has happened in the last few years, really, how we approach and how we treat breast cancer. And it's going to continue to change. We're seeing now that some cancers are being treated with chemotherapy before they have surgery, and then they go in and do the surgery and they don't see any sign of the cancer left. So there may be even some newer changes. You know, we may reach a point where some breast cancers are treated without surgery. You know, that's one of the things that women have a fear about. Am I going to have my breast removed? I don't want to lose my breast. And there may be cases in some types of cancers down the road that we don't have to do a surgery, that we can just treat it with medicine. So there's a lot of research, a lot of new things coming on. You don't need to be afraid of breast cancer. That's the thing. It can be a scary thing, but we need to know that God created our body. We're fearfully and wonderfully made. This was what I was reading this morning in the Psalms 139. We are fearfully and wonderfully made. God created us. He also created our vulnerabilities with the cancers that we have, but he also created us with minds to know how to go forth and to treat those things. So not to be afraid, but to find out the soonest you can. It's also so confusing to women because there are some groups that say start having a mammogram at age 40 and do it every year, no matter what. Some groups say do 40 every other year. Some people say stop at 75. I mean, it's confusing if you start looking at all the different groups and what they suggest. Each person needs to talk to their doctor personally. At age 40, I recommend we start doing mammograms every year. We find a cancer often by seeing a change that might be there that wasn't there the year before. And then the next year, there may be something a little bit more different. And so you have to be able to monitor along the breast to find the cancer at the earliest chance. And so we only do that if we do it on a regular basis. And my recommendation, and knowing all the data and practicing for almost 40 years, is that we need to do it on a yearly basis. So and there's been improvement of that, and we can talk about that some too.
That's
Okay.
awesome. That's
And you know,
awesome.
you mentioned about the new changes about how they're doing the radiation or chemotherapy before the surgery.
Mhm.
Well, I have a niece that is going through that right now. Because I asked her when is the surgery. She said, well, they're doing the chemo and radiation before the surgery. And I said, wow, I never heard of that. So you're absolutely right. So I have a niece right now who is going through that right now, that they're treating it that way. So it's good to know. So if you didn't know that out there, guys, there is other new treatment. Take the time to educate yourself. Dr. Besson is right here in Aiken, South Carolina, Women Health Associates, guys. I mean, I'm pretty sure she have lots of information over there that you can just go over or call and get some information. But educate yourself, you know, become aware, get to know your body. And that's another thing, Dr. Besson. Who knows our body better than us? You know, and that's why early detection is the best protection. And you know, we have the lady who started Know Your Lemons. You know, tell us a little bit about that. And that, you know, you have that shirt on, so kind of tell us a little bit about that.
So this year, when we just started looking at what we were going to do for breast cancer awareness, we had known about the program Know Your Lemons, and we decided to do that. So we have a lemonade stand in our lobby, and we all have T-shirts about lemons, Know Your Lemons, and it is important. I have patients every year that have had a normal mammogram. They, everything was clear, and then 6 months later they call because they felt something abnormal. If you don't know your breast, you need to get to know your breast. Know what your breast feels like. Know what it's different. And the thing I tell people is when you check your breast, you will be pushing your hand against your chest wall. And so those are two areas that have a lot of nerve endings in them, and they will tell you if there's something different. And so once a month at least, check your breast, know what it feels like, know if there's something different. Don't be afraid to do that. Some people say, oh, don't check my breast because I'm afraid I'll find something. Don't be that person. Just know your breast, just feel your breast and know what your breast feels like. And then when there's a change, your body will tell you, and then you can go and get it checked out.
That's good.
Yeah.
Now, Dr. Besson, let's talk about dense breasts
Okay.
and the difference in a mammogram, a diagnostic, or 3D ultrasound. Let's give the women the information about that because a lot of women don't know about, having dense breasts, where the tumor can hide in dense breasts. Let's talk about that.
Okay. So 40% of women have dense breast, and you can have dense breast throughout your whole life. Most of the time, breast density decreases with age. However, there are some women who the breast will remain dense into their 90s. Cancer is less likely to be seen on a mammogram if you have dense breast. So we can do a mammogram, everything looks normal on the mammogram, but there could be a cancer there that could be a significant size. Until this recently, in the last couple of years, there has not been another screen to offer women other than a handheld ultrasound, which is very hard to look at through the whole breast with just a little wand. So there was a group that created a new way of monitoring dense breast, and it's called the Automated Breast Ultrasound, or ABUS. ABUS is the way that we call it, ABUS. And it is a second screening, so it doesn't replace mammograms, because mammograms can pick up calcifications and other things, so we still do a mammogram, but we also do a automated breast ultrasound, and it's just a ultrasound that sweeps across the breast at multiple places on each side and forms a 3D image of the breast with ultrasound. There's no radiation involved. It takes about 20 to 30 minutes to do, and then the radiologist uses it and looks at it often and compares it to the mammogram as well, just to see if there's an area there that could be hiding in the breast that we couldn't see on mammogram. We in our office have found multiple cancers. This past year, we've been doing the ABUS along with the mammogram for a year. And it's been a little scary to know that there's still women out there. We offer it to everyone who we send a letter to that has dense breast, but not everybody calls and schedules it. So we're hoping people are understanding that if you have dense breast, you need to have 2 screens done. You need to have the mammogram and the ABUS.
Oh, wow. You have a question, Dr. Besson, from Facebook. Does the dense breast apply to men as well?
Well, the thing is, we don't routinely, because the incidence of breast cancer is so low in men, that we don't do screening on men. But if you know how a man's breast is, it has a lot of testosterone, which by definition is going to make their breast tissue denser. So yes, they have denser breasts than women do.
No. So now you talked about the ABUS. Why would a woman just, if a doctor don't recommend it, and insurance said, well, I'm not paying for it, how can women get it? I mean, how can they get that if that can help their chance of surviving and identifying things? How do you get your doctor to, get that mammogram done, get that done for you?
You can request an ABUS to be done. If you get a letter saying that you have dense breast, then you can call and say, I have a letter from my physician that says I have dense breast and I want to have an ABUS. Just like a mammogram, you don't have to have a request for you don't have to have a written request from a physician to get a mammogram, and you don't have to for ABUS. You just have to have a physician to send the report to. So you need to be followed by somebody, but you don't have to have their written request to get this done. If you have a mammogram report that says you have dense breast, then you qualify for ABUS. And most of the insurance companies and most of the Medicare are paying for it. So it's not an issue. They, at this point, are paying for it. We keep working at trying to have better coverage for things. Your insurance may not, but you can still pay cash for it. We offer a cash price, as well as I'm sure other places. I think that there's only 1 or 2 places in Augusta that's doing it. There's only 1 place here in Aiken, that's us, that's doing the ABUS. So it's not a very common machine out there because it's new and it's expensive. So but it is so important. So we just have to get people out there saying, I want to have this. And then more people will be offering it because it's going to be demanded.
Okay, so go ahead and share that with the CSRA again. That is Avis. You can spell it so they would
Right.
know.
It's a abbreviation, capital A, capital B, capital U, capital S, and it means automated breast ultrasound. And it's a machine that sweeps your breast in sections and develops a 3D image with ultrasound of your breast tissue to look at it differently than a mammogram, because you need 2 ways of screening your breast if you have dense breast.
All right, so I hope you ladies, you heard that out there. If you have dense breasts, this can be a way of you detecting something that could be there, that could be hiding, that you don't even, you aware of. So, and you don't need, you just have to have dense breasts and just report from your doctor to get it done.
Right.
All right.
Let's go to the break, Jack.
Okay, so guys, we're gonna come up here on a break here, and guys, just stay locked down right here on Health Matters as we continue to talk about and wrap up Breast Cancer Awareness Month. All right, we'll be right back.
And Coach Patrick, you like that better?
Oh yeah. See, I was knocked off at the beginning, so I'm like, okay, you know, you're in that routine and that habit.
Yeah.
Guys, CSRA, Facebook, guys, thank you for watching on Facebook. I didn't acknowledge you this morning, but thank you, and thanks my Facebook administrator who is putting out the information out there. But guys, I just want to hats off to Dr. Besson and just getting up early this morning and coming out here and sharing this wealth of information to the women and men of the CSRA, guys. Don't take this lightly, guys. I mean, the word of God said, my people are destroyed of a lack of knowledge because they reject the knowledge. When you have someone that is God-fearing, spirit-filled, and a woman of God, and a doctor, you know, come on, you got to, you know, adhere to the wisdom, you know, that God has given us. I mean, just not the practical part of medicine, but as a woman of God, you know. So yes, you know, we always want to be mindful, you know, that God give us doctors. He give us people to help us. You know, we can't diagnose ourselves, so we got to have people in all places, you know, to help us. So, and we have our faith, and of course we trust God, but we can't get foolish in our faith and not go do the practical things that we're supposed to do.
Okay.
So we're back here with Dr. Besson here in the Chandler's Law Studio. But I want to give a shout out to our general manager, the team of WAW, and everybody that volunteered. The Shout Fest was like
Awesome. Oh,
phenomenal.
How can we not say something like that?
We
had a great
was
time.
all off beat, but that's all right. That's all right. But it was so phenomenal, guys. Everything just flowed so well, and we just thank all the sponsors: Chandler Law Studios, Pam and Powers, them, Big Powers, McDonald, every sponsor, Platinum. Who all the audience done season the light, you know, if I miss you, Charles Knight, yes, Burn, yes, everyone. It was phenomenal. It was just
Benjamin Entertainment Group.
Everybody that was in there. So they you know who you are out there. It was phenomenal. But thank God, you know, we don't know the work that was put in or what it took to bring that. You just see all of that, but you don't know the back stuff of it and what you have to put together to get that to the people. So we just want to give that shout out to Donna Westby because her heart, you know, and her passion.
And thank the people for continuing to support.
Support, yeah, absolutely.
Showing up, you know, and coming up, fellowship, and coming together and having a great time.
Absolutely.
Yeah, it was good.
Yeah. So we're going to go ahead and get back into this. Go ahead, Coach. You have something?
So we know that the 2 most common risk factors are simply being a woman and aging for breast cancer. So we just talk about a few risk factors of breast cancer, Dr. Besson, and then maybe just go into some signs and symptoms. We've been talking about it a little bit, but let's just kind of focus on that a little bit.
Sure. So the main thing, like you said, is just being a woman. Every single woman is at risk for breast cancer. Men are too, but not as much. So we're talking today mostly about women. So we have to figure out a time when we start doing screening. When is the best time? Because you don't want to screen too early where you're doing screening and not finding, or you're not adequately finding people. So we have looked through the years and decided from looking at all the numbers that age 40 is one of the best times to start screening, and that you are at not at high risk at age 40, but as you age, your risk increases with age. Every woman is at risk, but the older you get, the higher your risk is. And that's why I tell people, as long as you're up and about and can come to my office and get a screen, I don't put a time where I stop it. There are some people that say you stop at age 75, but 25% of breast cancer is found in women over 75. So why are we going to stop screening at 75? It makes no sense. Makes no sense. So don't listen to somebody and say, oh, you're 75, now you don't need to have screening. No, you qualify for screening and your Medicare will pay for it. So don't stop screening just because you're over 75. But at 40, most women should start screening. People always ask, well, I have, my cousin that has breast cancer, should I start sooner than 40? People want to know, should they start sooner than 40? There are cases that we start sooner, but your breasts are so dense the younger you are that the mammogram may not be adequate for screening. So if you are truly high risk, let's say you have a first-degree relative, you have 3 first-degree relatives with breast cancer, or a male with breast cancer, one male, but you're in a high first-degree relative with breast cancer, you're in a higher risk category, and you may start screening either with mammogram or with MRI. There are other ways to do screening sooner, and you need to be evaluated. 2%, only 2% of breast cancers are genetic. And when we mean genetic, meaning they have a BRCA gene, a breast cancer gene that makes you at a high risk, where you are 1 out of 2 chance of getting breast cancer instead of 1 out of 8. That's only 2% of the breast cancers are those people. So people think, well, I don't have anybody in my family who has breast cancer that is close to me, that's a first-degree relative, so I'm not at risk for getting breast cancer. Oh yes, every single woman, 98% of the people who get breast cancer don't have that gene that puts them at high risk for breast cancer. Wow. They just have breast and they're at risk.
Wow, that's good. I mean, that's good.
It's something, and that's why it's so important,
about.
like Dr. Besson said, is to get your screenings when you're able to do it, and continue to do it as long as you're able to do it. What's the youngest you've seen, Dr. Besson, that you've seen breast cancer in, the youngest?
Well, it's very, very rare. And anytime you start talking about the rare things, people start getting freaky that, they're going to have something. But 25 is the youngest I've seen.
Mm-hmm.
And that's extremely rare. But if you have a mass in your breast, it doesn't matter what age you are. I have girls that come in who are teenagers, and they come in and they have a mass in their breast. And it may not be a cancer, but it may be something that needs to be addressed, evaluated, eventually removed, because you can have non-cancerous things in your breast that can cause problems with your breast that still need to be removed or treated. So you can have a infection in your breast, and you can get really, really sick with a breast infection if you don't get it treated. Mm-hmm. So if you have an abnormality in your breast, no matter what age you are, you need to go in and be evaluated.
What are some other signs and symptoms that you can share with the CSRA other than a mass? Because I know there's maybe other signs and symptoms.
Other 12 signs.
There can be a dimpling in your breast where it puckers down a little bit and looks abnormal. You can have a change in the size compared to the other breast. You can have a retracted nipple. You can have blood coming out of your nipple. You can have pain. Pain is one of those things that's difficult because you can have pain in your breast. Most of the time, pain in the breast is not cancer, but pain in the breast does occur with breast cancer as well. So you need to be aware of that and not just ignore your breast if it's uncomfortable and painful. You can have redness on the skin. A rash on the skin is a rare type of cancer can show up with a rash on the skin.
Okay, good. Jack, you got anything?
No, I mean, I'm just letting her have it because I'm letting the expert have it. But because, see, I have it, I experienced, that I had a rare case where I didn't have a lump. I had calcification. Mm-hmm. Mine were called microscopic. Right. And so it was at 0 stage. So thank God and it was contained. It was like contained in my duct. So after all these years of my mammograms, nothing, so I had calcification, just like Dr. Besson said. It ain't always sometime a lump. It's just calcification around the breast.
Right.
So that's why I say it's very important to get your screening. But we think about it, and I just, and that's why I started the organization Believe after I was diagnosed, because it was very important that I did something in the community, and I asked God, what can I do? So I wanted to make sure I did something that would support local organization. So one was the Lydia Project. Now it's the Cancer Service Center. They changed it because they see men, babies, boys, so they see different people now. And also is Piedmont University now. So, and we started that, Jackie Fitness and Wellness started that because I wanted to, it was so many women that I was running into that didn't have insurance. They had no means of getting a mammogram. They had no transportation. So that organization, they support, and that's where Miracle Mile Walk, all those, that money stays local. We had Laura Hott on the show a couple of years ago, and she verified that, all the money stays local, and it helped women to get free mammograms. So they take the mobile unit out to different places where people that don't have transportation and can't get to a place to have mammogram, they take it to them. And a lot of women has been diagnosed with breast cancer, through those means. So that's why it was so important that I started the Believe organization to help women raise money to help women. I want to thank all our sponsors, all our people that helped us raise money for the Miracle Mile and for the women. So thank you. We didn't get our budget of $2,000, but that's all right. We got $1,250. That was good. Mm-hmm. So yeah. So that was awesome. That was better than nothing, right? So, yes. So go ahead, Coach.
Yeah. So Dr. Besson, like we always say, it's time goes fast when you're having fun. So, but we just want you to share with the CSRA anything that's on your heart. Anything you got coming up, or anything. It don't have to be about breast cancer. So whatever you want to share, go ahead and share that.
Well, this morning, one of the things that was in the scripture I was reading was about how we are fearfully and wonderfully made. And sometimes we get scared, and God, I think, doesn't want us to be scared. He created us. He's in the boat with us, even in the storm. And he's not going to leave that boat. And so no matter what you're facing in your health, particularly if you are facing breast cancer, it can be a scary thing, and it can be confusing. And God is not a God of confusion. So, I just encourage people to go out and seek people to help them find their way when they're dealing with a medical issue, whether it's breast cancer or somewhere else. Medical issues can be confusing and difficult. And so God has given you people in your life. You just need to reach out to them, to ask them to help you through those times. And remember, God's in the boat with you, and he's going to help you through the storm. And when you weather the storm, just like Jackie was, then he has encouraged you to help others weather the storm and to know how to traverse those difficult waters. And we're so thankful for y'all and for what you do in the community as you help empower people to take charge and to take their health serious and to do what they can to live the healthiest they can.
That's awesome. Thank you. And we enjoy doing what we do. It's just a passion that pushes us and drives us to do what we do, because we truly, truly love to see people, get better, and whatever that looks like for them, and that's different for everybody.
Yes.
It really is.
And that's the thing, and that's what I like with, it looks different on everyone. Just because you may have been diagnosed with type 2 diabetes, that doesn't mean you're not healthy. That means you're managing it. Right. So, things, certain things come with aging, but we all want to age healthy. We all want to age well. Mm-hmm. So, but we, like I said before, we have the power within us to change habits that can change those genes. Yes. That causes us to make us more prone
Right.
to chronic diseases. So we got to do our part, and I always say this, and I'm gonna continue to say this, is our responsibility to steward over this temple, and it's God's ability
That's right.
to keep us.
That's right.
But we got to do our part.
That's right. We do the natural, he'll do the super, and we have a supernatural
There you
outcome.
go. And
Yeah.
he rewards the
He's that
effort.
type of God.
Yes, he is. He's
Y'all
an
starting to
awesome
preach up
God.
here now.
I'm telling you, he's a phenomenal God.
Yes,
I tell him he's a great daddy. You know, he's a great father, and he wants to hear that. And, you know, and that's why we have to trust him. But he also give us wisdom to do the things that we need to do.
Mhm.
We invite him in every area of our lives, but when it comes to our health, for his eating right, we don't want to invite him in there because we like, okay, no, I still want to continue to eat the things that I can eat. And we're not telling you not. It's just like I said before, it's what you do consistently,
Right.
not what you do occasionally.
That's good, Jackie. That's good.
Yeah.
So, Dr. Besson, go ahead, and if the people want to visit, come and to Women's Health Associates, give them some contact information, how they can get in contact with you,
Yes.
so that they'll know that information.
So you can go to our website at Women's Health Associates. We have simplified a little bit. It's aikenhealth.com is an easier way to look at it than, or WHA Aiken.com, but aikenhealth.com. You can learn about what we have available there. You can call our number at 803-648-0803 to see if you can make an appointment or to ask questions.
Yes.
Awesome.
And I want people to know that Dr. Besson was our medical expert speaker for Wow Women on the
Yeah.
Wellness last
So much
year.
fun.
Yes, and we still working on some things together. We just have to, you know, work through some stuff, but we're working on some things for Aiken.
Yes.
So it's coming, you know, in God's time, and it's going to come. So, and it's going to be great when
Yes.
it does come. Every delay is not a denial. It'll be greater later.
It will be. It will be.
SRA, we'd like to thank you for listening to Help Matters here on Shout 94.7 FM, the station of inspiration, empowerment, information. Remember, we're here to help you to become a better you, to be the best you that you can be. We'd like to leave you with 3 John 2. Beloved, I wish above all things that you may prosper and be in good health, even as your soul prosper. Guys, you have a blessed and wonderful day. All right, guys. See y'all later. Thanks for joining in. Always a pleasure. Yes. Thank you. Thank you. Thank you for the love. Thank you, guys. Great information. Go back, share with your family. It's a lot of great new information that needs to be shared with the ladies out there. All right. Love you. Thank you so much, Deb, for managing this site. Thank you for the love, guys. Appreciate you.